let's go ahead and get started. We've got a lot to cover. And as I said, I have a few surprises for you in the April Fool's edition tonight. Okay, I don't have any disclosures tonight, but I would like to thank Ken Lin and Janetta Parton at the Extra Light Labs for helping with some information about this talk tonight. We're going to start with a story, and rather than make up a story, I thought I'd take one of the classics that you all know of and take a look at this image on the screen and see if this means anything to you. As you remember, Dorothy met up with a few friends on her trail through her search for Oz after she left Kansas. What could this story possibly have to do with my talk tonight? Well, let's find out. First, she met up with the Cowardly Lion. And what was he in search of? Courage. And when you go to get your eyes checked, expect to discover the strengths and weaknesses in your vision, your eyes and your general health. That's one of the things that we're going to be looking for. So we want you to discover things, and it takes a little courage to sometimes do that. Next, she came across the Scarecrow. What was he looking for? Brains. And we expect you to learn as we teach you about your eyes and your vision. Those are some of the things we like to do here at UCI. And finally, she came across the Tin Man, and we all know he was in search of a heart. So using the tools of our trade, glasses, contact lenses, magnifiers, exercises, eye drops, compresses, lasers, surgery, we can prevent, heal, or compensate for the issues you have. Putting those together, bring your courage to discover, your brains as we teach you, and your heart because we are going to work with you to heal. And that happens to be the mission statement of Gavin Herbert Eye Institute: discover, teach, and heal. So we have these great specialists here at UCI, and these are all the eye specialists departments that we have within our building there: the retina, the cornea, glaucoma, cataract, neuro-ophthalmology, oculoplastics, pediatrics, strabismus, refractive surgery, and low vision. So some of those talks will be given later on this year and throughout the years to come. What do these next four people have in common? First one, Ray Charles, Stevie Wonder, Andrea Bocelli, and here's a person you may not recognize, Helen Keller. So the commonality between them, as you probably have guessed, is that they were all blind. And my question to you is, imagine what it would like to be blind. Our gift of vision is so precious that we just take it for granted way too often. It's almost like we can't appreciate it enough. But the clarity and acuity that we have in our vision to observe form and shapes, shading and texture, all these things make up the beautiful images that we see. But if you've never seen, what is it like to see? Well, that's one of the things that we have as our mission, is to have you see your best so that you can do and be your best. We don't want you to miss out on anything in life. And this is one of the dedicated things that we have to help you with. Unfortunately, our eyes and vision do change with time. We know that, you know that. So what are the factors that change our vision, and how can we anticipate them and care for them? Well, everything about your eyes and vision is really summarized in these two words, nature and nurture. So nature is what you're born with. It's the DNA from your parents, and it provides the blueprints for your eyes. Nurture is how you use them, how you abuse them, trauma and injury and disease. Those are the other things that can affect your vision. So what are some of these typical complaints that I get day in and day out at an eye exam? We'll go through some of these now. And if you go to your eye doctors, bring your complaints. We expect them. We want to hear them. The more detailed they are, the more we can help you. So the most common one is probably blurry or fuzzy vision. That's one everybody can relate to from time to time. So we have numerous ways we can help you with that. Ghost images, halos, and glare, those are common complaints. And they're usually caused by one of these two, cataracts and astigmatism. So we'll check your eyes and make sure you never get cataracts as dense as that one. That's just a horrible one. And astigmatism is something that we can care for with glasses, contact lenses, and if need be, surgery. Some people come in with complaints of double vision, and that can be very annoying. If anyone has a recent onset of double vision, that can be very, very serious. So you want to bring that to our attention immediately if you have an onset of double vision that you've never experienced before. Could be something that could be fixed easily, or could be something life-threatening. Let us take a look and make sure that we can care for that. The causes of double vision are when the eyes cross or go out or up and down in some ways. And they can be due to a muscular problem or a nerve control of that muscle. There's 6 muscles for each eye that control the way our eyes coordinate together in an absolutely fantastic way. It's a beautiful dance between all 12 of those muscles that keep our eyes coordinated and pointing in the right place, up and down, left and right, crossing, converging, and everything else. And so we have to manage that. And if you're ever having double vision, we need to inspect that to find out if there's something mild going on or possibly a stroke or something like that. Then there's distorted vision. Distorted vision usually comes about from issues on the macula or the back of the eye, the retina. So this test that we have here with this little dot and the checks all around it is called an Amsler grid. And we use that testing one eye at a time to try and map out where the distortions are related to your macula and how severe they might be. This is a set of photos that I put together to illustrate the retina on the back of the eye. So over on your left, you see an eyeball with the retina. The optic nerve is right there with the little square around it. And you can see all those layers of nerve cells that make up the retina. So the back of your eye, paper thin, includes the retina. 10 different layers of nerves in that paper thin piece of retina on the back of your eye. 120 million nerves make up your retina, and they're like all the pixels in a camera to give you the image you need. However, 80% of those 120 million nerves on the back of your eyes are located in a pinhead-sized spot called the macula, sometimes referred to as the fovea. And that provides all the sharp details. So you can imagine if there's any swelling behind that little spot, it can lead to distortions and irregularities in your vision. Those photos that you see on the right are of problems in the eye, hemorrhages and swelling and different things like that from various diseases. A more common problem that lots of people come in with is eye strain. And that's a generic term for overuse of the eyes or use of the eyes without the proper glasses, extended use of the eyes that just goes on too long during the day. Dry eyes can contribute to this. So our computer time has greatly exacerbated general eye strain for people. And it's something that we can certainly help you with. We've got all kinds of tricks up our sleeve to help combat this general problem that people have. Now we're going to talk a little bit about flashers and floaters. Well, what are they? Where do they come from? So think of your eye as a big, clear jello ball that's filling the inside back of the eye, a big, solid jello ball. And it's made up of fibers that keep it solid, jello. And starting about age 5 to 10, the fibers that make up that solid jello ball condense on themselves. And they form little strings and strands, and those are the normal floaters that dance around in our vision even when we're a little kid. If we look up at a big white, gray sky or a white wall, we can see these little floaters dancing around in our vision. We look to the left, we look to the right, and they come along with us. Those are normal, expected, everybody gets those. Eventually, that big solid jello ball, which is contained in a clear baggie, all the way around, the clear baggie is attached at the very front of the eye and the very, very back, right where your optic nerve is, where your eye and your brain connect. So if all the fibers that make up the inside jello ball start to condense too much, then you have a jello liquid mixture, and the liquid can seep through the baggie, and the baggie can rip away from the back of your eye. That's normal and it's expected, but when it rips away from the actual optic nerve, then you get something called a posterior vitreous detachment. This is another common occurrence, and it's expected. By age 65, 65% of us have this baggie rip away from the back of the eye. And as you can see on that little photo on the left, I took that of a patient a few years ago. That perfect ring has popped forward in front of the optic nerve at the back of the eye. So that ring has popped forward and is floating nearly directly in front of the optic nerve. Now, when that happens, if it drifts over in front of your line of sight, boy, do you notice it. You'll notice something like, oh my gosh, I never had that thing before. What's that all about? And it's in one eye, but not the other. And it's kind of a big blob. The photo that I took is so rare because the circle remained unbroken. Usually they break and spin around and form all kinds of crazy shapes. But this is such a rarity to see a perfect circle that's popped forward from the back of the eye that I sent it into an eye doctor's website with all these people that comment on it. And they all thought it was just fantastic to see this perfect circle pop forward, had not yet broken. And I used the quote from Leonardo da Vinci to describe it, as he said, "He who can draw the most perfect circle is the greatest artist." Now, we're going to move to another problem that people have, and we see this in our offices every day, all day long, and it's called dry eye. The photo on your left shows an eye that's really in good shape with a tear film that is coating the eye perfectly, and there's no dry spots, and it just looks great. On the right, you'll notice a lot of dead skin cells. So when we stain the eye with this yellow stain called fluorescein and put a blue light on it, it glows bright green. And when that happens, we can see where there's chipped away, dry, dead skin cells on the front of your eye. If you have a lot of them like that in a pattern, well, this is a person who's probably sleeping a little bit with their eyes open at night. Their tear film is not protecting their eye, so they have a band of dry, dead skin cells there. This person on the left over here has a much bigger problem. You'll notice the black holes in their tear film, the mucus strands up and down that are irregular tear film, and then the thousands of desiccated, dry, dead skin on the front of the eye. So this person's probably complaining a lot, can't see very well, and needs some serious help to get back on track. If this condition isn't cared for, then the skin on the front of the eye can not heal well enough to ever be good again. And those people can have lifetime problems. So managing your tear film is very important. Those of you on the computer, take extra warnings. You have to use artificial tears, blink more frequently, and I'll show you some other things we're going to be doing. On the right, there's a little image of your tear film. It's made up of three things. The green is the mucus or mucin layer that sticks to the front of your eye. In front of that is the aqueous layer or water layer. That's what keeps everything moist. And then critically important, out front is the lipid or oil layer, and that keeps the whole tear film from evaporating. All three of those are critical. They have to all be present in the right amounts for you to have a good, healthy tear layer to protect your eyes. Here's the kinds of things that we use to treat dry eye. Number one is artificial tears. Preservative-free ones are certainly the best, and you may be using them anywhere from 2 or 3 times a day to 10 or 20, depending on your problems. Omega-3 fish oil capsules by mouth, not in your eye, can help to decrease the inflammation in your lids and lashes and provide for better quality tears. A teaspoon of olive oil by mouth, not in your eye, every day can also do that. That's kind of a poor man's fish oil treatment. Then at the bottom, we have something called a Bruder mask. It's something that's placed in the microwave with a warm rag, wet rag around it, and you heat it up and you lay it across your eyes and massage right through the mask, and that helps to stimulate the oil glands in your eyelids to produce good quality oils, and instead of avoiding the waxy buildup that might occur in those oil glands, the regular oil pushes that out and you get a nice flow of oil. Every time you blink, a microscopic little tiny amount of tears comes out, and that helps to reset your tears to keep them good all day long. Now, sometimes people come in and they say, well, I can't have dry eye because my eyes are watering all the time. The problem is that most of the time your eyes are watering, it's because you have dry eye. Dry eye causes the front of your eyes to dry out, and you have 2 gears to release the tears in your eyes. There's a trickle gear. We'll call that the first gear. It's just a microscopic trickle. Every time you blink, there's a little bit of tears that comes out to help refresh and replenish the tears on the front of your eye. And then there's the second gear, which I call the dump truck. And the dump truck happens when you get emotionally upset, or you get poked in the eye, or you see a great movie or hear a song that's just so inspiring, the beauty of it just causes you to cry. But the dump truck occurs when your eyes are dry. So the front of your eyes dry out, they stimulate your brain to say, hey, we need a lot of tears here, let's bring in the dump truck. So your eyes are watering all the time, but the problem is you have dry eye. Let us take a look and see if we can help you with that and get you back on track. It's usually not a tough fix, but it's very important. So what are some of the problems that optometrists and ophthalmologists find when people come to them? What are the things that we're going to be looking for to help you? Well, the most common one has to do with the optics. As you can see, that fellow on the left over there is using a phoropter to refract this young lady and find her best glasses to help her see her best. Nearsightedness occurs when the eye is just a little too long. And as a consequence, the focus of whatever you're looking at ends up in front of the back of your eye. And it needs to be pushed back further. So these types of lenses here that are illustrated in yellow are minus powered lenses, and they push the image further back to help you see more clearly. Other people are farsighted. They're what we call hyperopic, and their eyes are too short. They need focal strength in their lenses to pull the image forward to match the retina on the back of their eyes. And finally, we have astigmatism. This is the most misunderstood of all the optical problems. And as a result, I want to go over that with you right now so you can be an expert on it. So if the front of your eye is shaped like a basketball there, nice and round, then the light coming into your eye will focus somewhere as a point. If, however, the front of your eye is shaped a little bit like a football, more like this, the cornea that is, then a point of light that you're looking at is not going to focus anywhere as a point. It's going to focus as a smudgy blur somewhere around your eye, but not in it. And astigmatism causes all these issues that are illustrated over on the right there. Glary headlights, blurry images, and all kinds of problems. And you can't really get rid of it. You can try squinting, but it still doesn't get you to see nice and sharp. So what's really happening with astigmatism? Well, the light's coming into your eye, and instead of focusing as a nice pinpoint, it ends up being shaped in a crazy thing like this. This is a model I made. It's called a conoid of Sturm. And this little model that I made out of some paper and some staples and tape illustrates the defocus that occurs from astigmatism. So let's take that word astigmatism apart. The root word is from the Greek, stigma, which means point. So when you put an A in front of it, astigmatism, astigma, you're really saying no point. No point focus from an astigmatic cornea that's shaped like an American football. And it creates this defocused, smudgy, messy, non-sharp image at the back of the eye due to this conoid of Sturm. And since we have all kinds of physics majors and PhDs and all the medical students, I have to be able to teach them all this stuff. So that's why I brought some of my little toys here tonight. Okay, so beyond astigmatism, we have the result of it is blurring at all distances. It's caused by an irregular or football-shaped cornea, and it can create those ghost images and overlapping images that we have to deal with. So that's why getting a good refraction for glasses will help get rid of that. And finally, we have something called presbyopia. And this happens to everybody over age 40, whether you're farsighted or nearsighted or have astigmatism, or even if you have perfect eyes. Once you hit 40, the lens inside of your eye becomes so hard, it won't change shape to allow you to focus up close anymore. So you're stuck with far away vision, but you can't read your paper and you can't see people's name tags and you're kind of pushing things further out. So we have to deal with that. And it's caused basically by that hardening of the lens in your eye. And this graph I made explains it. So if you can just take a minute to try and understand this graph, you'll really understand what's going to happen to you throughout your life. So we notice in this graph that when you're 10 years old, down at the bottom, if you go straight up, you have a huge focusing amplitude or ability to change your focus. And you can focus right up to the tip of your nose when you're a young kid. That focusing ability goes downhill as we age. And you can see 20, 30, it's going down all the time. This happens to everybody, no matter what your sex or your ethnicity or whether you eat certain foods or not. This happens to everybody at this time. The blue line represents the 6 units of focusing that we need to be comfortable reading. As you can see, the red line crosses the blue line right at the number 40. So age 40 is when people start to need bifocals. That's when they come in complaining, hey, I need something else for up close. These glasses aren't working for everything anymore. Unfortunately, the graph gets even steeper after 40. So between 40 and 50, the graph gets quite steep, and that's when everybody's coming in needing help for bifocals. Fortunately, we have great bifocal designs for glasses. We'll go over some of that a little bit later. We have multifocal contacts. We have all kinds of surgical procedures that can help out with things. So we've got answers for you. Just bring in your problems. That's the bottom line. To summarize then, before age 40, we lose our ability to adjust our focus. After age 40, we just lose our ability to focus. That's when you just have to get some help from glasses. So that's kind of how that all happens and is summarized there. We do have some solutions for you to your focusing problems. Over on the left, you see what Ben Franklin came up with in the 1700s, the first bifocal. He created that in France so that he could see his food and people across the table. And that straight line bifocal has helped us to design newer things, of course, that are much better. We have multifocals with no lines, progressives they're called. We have special office lenses that are designed for computers and reading and just are magnificent for those kinds of things. We have eye exercises that can help kids and adults, glasses for just for reading. Even if you have perfect eyes, wearing glasses for reading can help prevent overstrain, which leads to nearsightedness, and we don't want that. So I also included something called the 20-20-20 rule down on the lower left. Well, what's that all about? The 20-20-20 rule says when you're working on a computer or paperwork or reading a book, every 20 minutes you want to stand up, push yourself away from the computer, look out the window or across the room at least 20 feet for 20 seconds. That's the 20-20-20 rule. Every 20 minutes, look at least 20 feet away for 20 seconds, and that'll help keep your eye muscles relaxed so they're not so tense. We don't want your eye muscles to get so tense that they just stay there or tug your eye, even worse, into a nearsightedness that you don't want. That can permanently ruin your vision. We just don't want that. Eye alignment and coordination. So some of the testing that we do involves this little stereo test. It's over here on the left. And it looks like it's a game for kids, but actually that test tells me more about your vision system than any other single test I could do for you. Because in order to do that test really well, everything's got to be working pretty well or nearly perfectly. Your vision has to be clear. Both eyes have to be seeing well. The tracks from the information have to be going back to the brain, and your eye muscle coordination has to be perfect. Everything's got to be working for that test to do well. So it's a good screener for us. As you can see, some of the photos of the people down below have eyes that turn out. That's called exotropia. Eyes that cross, that's called esotropia. And then you have eyes that have a vertical deviation up or down. And for those folks who are seeing double or having trouble with their vision, it's not as comfortable as they'd like, it's sometimes beneficial to have a certain type of prism put in their glasses. It's a type of a grind on the surface of the lens that bends the light up or down, left or right. It doesn't change the focus, it just changes the direction. But it helps some people to be infinitely more comfortable with their vision, and they're so happy they get it if they need it. If you don't need it, you don't get it. But boy, if you need it, it's a godsend. Eye movements. So most of us take this for granted. You don't really understand all the complexities that go in these movements. Earlier, I talked a little bit about these 6 muscles in each eye that help coordinate your eye movements. Well, there's one type of eye movements that we test for. It's called saccades. And the saccades are jumping eye movements. They're eye movements that take you from point A directly to point B without a stop. So it's a jumping movement. And that's what you actually use when you're reading or when you're looking around a room at different points and places, or if you're examining a portrait or a picture, you're going to have eye muscle jumps that jump from places on the photograph or the picture so that you can take in the whole thing. A second type of eye movement that's different, it's controlled by different parts of the brain and uses different neural mechanisms, is called pursuits. And pursuits are smooth eye movements that continually flow, always following a moving target. So pursuits are just following something flying in the air, like a bird or a ball or something like that. Let's get into this a little bit better. Here's the saccades I was talking about. So on the left there's a image of Nefertiti, and it was mapped, people had their eyes mapped out to see, when you look at that, you don't just take in the whole image of Nefertiti at once, contrary to popular opinion. Your eyes are jumping around in 30, 50, or 100 places to capture the salient or important information in that image. And you can see the map of where people's eyes jump around on Nefertiti to take it in. The important places are the eyes, the nose, the lips, and the ears. On the right, there's a portrait of a girl, or I should say a photo of a girl, and a mapping of where people look at her face when they are examining her. Eyes, nose, and mouth. A little bit around the edges, but the important information is where it's all spent time with. And then down at the bottom, for people who have trouble reading, sometimes they just don't have the good saccades and eye jumping skills to get the information they need. So when you look at that sentence, the knight attacked the windmill, the eyes are going to jump from one word to part of another to part of another, and sometimes they backtrack a little bit, but a good reader, an efficient reader, will move from left to right with as few jumps as needed to get all that information. But you can see it's really a complicated task for our eyes and our brain to process all that information effectively. Here's a portrait, a painting from the year 1665. I looked it up today. And this is by Johannes Vermeer. It's entitled Young Woman, Young Girl with a Pearl Earring. And it's a famous painting that is housed in, I believe it's housed in The Hague or in Brussels. This is the map of how people's eyes spend their time looking at that. So when you look at that painting, your eyes kind of pick out the chin, the eyes, and the earring. And Vermeer knew what he was doing when he created this painting. He wanted to create a triad and not just two items to look at. So this is the kind of the eye movement scan that summarizes where all that visual information is taken in. Now, as it is the April Fool's Day episode of this, I want to let you in on something. This was not his original model for the painting he did. This was his second choice. His first choice was this young lady. I don't know, she was lost to history, that painting gone forever. So now we're going to go to pursuits. I told you that pursuits were following something. You had to have a moving target to have a pursuit engagement with your eyes. So a bouncing ball, something moving, an airplane, or if you're out in the outfield playing a baseball game and you saw a deep line drive going to the outfield, you'd have to track that with your eyes. So that's that separate kind of eye movement system called pursuits. Now we're going to move into something that's of interest to most of us, color vision. And I've got some special things to teach you today that you may not be aware of, and I think you'll find absolutely fascinating. So let's start with this basic physics. There's electromagnetic radiation that has huge waves that go miles for a single cycle, and they get shorter and shorter, and they create radio waves and then microwaves, and then they pass all the way through our visual spectrum. There's a very small, tiny window of electromagnetic radiation that our eyes are sensitive to called visible light. Beyond that, it goes to ultraviolet, X-rays, and gamma rays. So this visible light spectrum is very narrow in the big picture of things, and we're sensitive to it with 3 different nerves in the back of our eyes in the retina. Those are some of the cones that see our color vision. We have a red cone, a blue cone, and a green cone. And together, depending on the ratio of how they're firing, it tells us what colors we're looking at. Now, the square on the upper left is normal color vision. That's what most of us hopefully see. And on the right, there's red and green color blindness or color defects. On the lower left, it's blue-yellow color defects. So these are 6% of men are red-green color defects, and 1% are blue-yellow. Very few women are color defects, but there are certainly women that have all those color issues. And then sadly, there's even some people, very small in number, that are true black and white. They see no color at all. And again, they're very few in number. We do have color correcting glasses that we can help you with and might help you to see a little bit better, to discern colors, you know, so that you can enjoy the world a little bit better. This next slide I put in kind of as a joke, but it's going to introduce our next issue. So color names if you're a girl, color names if you're a guy. And you can see on the left, there's just quite a list of more detailed names of the colors that our ladies seem to appreciate more, maybe from lip gloss and things like that. But anyway, this is where I wanted to get to. There's the human view of color, and then just below it, the dog. That's the dog's view of the world. Your dog is just like somebody who's a red-green color defect. And I said earlier that we have 3 color cones that do our color vision. And the color defects are missing half of 1 or half of 2, so they don't get the full expression of all the color, and they can not discern all the colors and wavelengths that we see as true colors. But imagine if there's somebody who has not 3, but 4 color cones. Well, indeed, we've recently found in the past 10 years or so, a small number of women and women only that are tetrachromes. I call them a women's version of the X-Men. And these are women that have 3 cones, but one of them acts as a double hump. So they really kind of have 4, and they see something above us in the color spectrum that we can only imagine. It's that kind of thing. And I think that's just wild. It is being worked on here at UCI. Dr. Kim Jameson is one of the investigators on that. She's a great person and really brilliant. So we're kind of forging ahead in this world of color vision here at UCI. Sunglasses, everybody has them. There's gray, there's brown, there's green. Gray is the only color of sunglasses that keeps all the color relationships the same. Brown and green enhance contrast a little bit, help you to pick out certain things. So some people like that. Brown is certainly a good protector of your eyes. It's probably the best protective color for your retina. Then there's the yellow blue blockers that people use on the computer. Real light, faint yellow, almost nothing, but it helps to enhance contrast a little bit and get rid of the glare from the blue wavelengths. So we also have transition lenses that change color when you go outside, and all kinds of anti-reflection coatings that can help make your lenses look and appear thinner than they really are, and cutting the amount of light that would otherwise escape and bounce away so that it can go into your eyes properly and may help you to see better. Workplace and safety glasses, contact lenses for people. We've just got so many tools that we can help you with. You just got to give us a chance, really. And in the world of contacts, we have softs, we have hard lenses or gas permeables, hybrid lenses that are hard in the center with soft skirts around the outside, and special new scleral designs that really make those very old contacts much more comfortable now than they ever used to be. For people that have real dry eyes, sometimes they need these special scleral contacts to fit. And sometimes when people come in and they can't see well with any glasses and they can't see well with soft contacts because the front of their eyes are so irregular, like the knuckles on my hand, and we fit a hard contact on them and tears fill in between, and the hard contact becomes the new front of their eye, visually speaking, and it can bend the light much more accurately. And those are the patients that I have on a basis that I wish I saw more of, because they cry. They put these lenses on and they look for the first time they can see the bottom of the chart, and they go from something like 2080 or 2100 to 2020, and it's the closest thing to a miracle they may have in their life, physically speaking, and they just love it, and so do I. So we like helping people that have, the bigger the problem, the more we want to help you. Low vision is the term that's applied to anybody that can't see 20/40 or better. If your vision is worse than 20/40, meaning you can see at 20 feet what the average person can move all the way back to 40 feet and still see, then you have what we call low vision. We've got all kinds of devices, magnifiers and telescopes and screens that blow things up to help you out. We have a low vision specialist at UCI to help those folks that need that. Okay, now we're going to move into the area of microscopic bugs in your lids and lashes. These are Demodex, and most everybody has these in their lids and lashes at some point or another, and they live in there. They cause all kinds of little trouble and create a mess and can cause your skin to get irritated and flakiness on your lids and lashes, and they are not nice critters. Well, we do have a way to take care of them and get rid of them. So let us do that before they cause styes in your eyelids and big swelling or all kinds of skin issues on the front of your nose and eyebrows. So we have various things that we sell right here at UCI, and you can also get some of this at any pharmacy. And it's basically some tea tree oil mixtures, and we have some medicines too that can help you. Hygiene alone does not really get rid of these little critters. The Demodex brevis and the Demodex follicularum need this kind of specialized treatment to get rid of them. So if you suspect you're having problems with those, come in and let us take a look, and we'll tell you if you have them or not. We're getting close to running out of time here, and so I'm going to move through this section really quickly to describe what a progressive lens is all about. It helps to get rid of aberrations in the eye. Those are problems that create issues for lack of clarity. So think of this elephant trunk as the front surface of a specialized progressive lens. It's a bifocal lens that gives you far, computer, near, and everything in between. That elephant trunk that's shown here on the left creates a lens that has powers as illustrated on the right. The pink is all your distance power. So you look straight ahead or up a little bit, and you've got nice sharp vision far away. As you look down in the lens, down towards the floor, you're going to get computer power, and way at the bottom, you get your reading. This is a standard progressive lens. We've had them for years. They're better than they ever were, and most people love them. But we have other designs too that help out with people working on computers all day, that really focus in on just computer on the top and reading on the bottom. Those are wonderful lenses. I use them all day at work, and I'm thrilled with them. Now, I'm going to spend just another minute or two on optical illusions, and then we'll say goodbye to Dorothy and her friends. Hopefully you will muster your courage to come in and use your brains and your heart so that we can treat you and take care of you and make the best of your vision world. And you can leave Toto at home, but if you want to bring him, he's okay in my exam room. Let's go to, we have time for just one optical illusion. I'll show you this one. Those lines would probably appear to you to be crooked, the horizontal lines, but in actuality, they are absolutely straight and parallel. And the reason that we see them as going this way, that way, and crooked is because of the subtle little black and white checkerboards that are lining the upper and lower side, tops and bottoms of each of those blue lines. And they throw our eyes into thinking that the slope is going the other way. And it all has to do with, how these optical illusions work. And I really haven't given it the time for you to do it justice tonight. That would be a whole other talk on how optical illusions work and what they reveal about our vision system. So our vision system can be tricked, and it's also pre-wired to look for certain things that make sense of the world. So I'm going to leave you with two quotes that helped us to understand a little bit about optical illusions, and maybe at some other day I'll have a different talk on these. And the first one is, perception is reality. So when you see things, even though they're not real, if they appear real to you, that perception to you is your reality. And secondly, I'll leave you with this quote: the mind decides what it wants to see, and the eyes go out and look for it. So sometimes the world is presented with optical illusions so that we're tricked, and sometimes our mind is tricked first, and we go out and look for things in a certain way because our mind is predisposed to look for something different. But anyway, thank you for joining us tonight.